Good afternoon, everyone, or good morning or good evening, depending on which time zone you are. We welcome you to this webinar. I'm Anita Mittal, Senior Advisor with GIZ, leading the Digital Convergence Initiative. So I'll quickly walk through you what we have in store for us on this webinar. So I will start with a quick introduction to what is this Digital Convergence Initiative, which has brought us all together for this webinar. Some of you who have been following us in the previous series may be already aware. This is a quick 5-minute intro for people who are joining us for the first time on what is the Convergence Initiative and what are the objectives of this dialogue series. This would be followed by a presentation from our host country, Turkey, who will explain the integrated and interoperable social protection system called ISAS, which will be followed by a very good dialogue discussion with two of our discussants, Mr. Chawla and Mr. Thomas. I will introduce them subsequently. And then we will open up the floor to the audience for their questions and answers to the speakers, followed by closing remarks by Veronica from ILO. With this, I just want to introduce you with some of the housekeeping rules. You can keep asking your question and answers throughout the presentation in the chat. Please type them in the chat box. Share any comments or resources also in the chat, not only questions. Simultaneous interpretation is available in Spanish, so you can switch to the Spanish channel if that makes more sense for you. And this session is recorded, so we seek your consent. If you continue to remain in this session, it means we have your consent to be recorded. This webinar will be hosted on our website after a day or two. So you must be wondering, what is this Digital Convergence Initiative? So this initiative is a joint effort by USP 2030 members and non-members, which includes governments, development partners, and private sector, which has come together to build a harmonized and interoperable digital ecosystem for social protection. So how do we plan to achieve this harmonization and interoperability? Through building consensus-based standards for interoperability. And what do we think we will achieve as a result of this interoperability? We believe that this will foster an ecosystem for innovation by ICT providers to build components which are interoperable and can be deployed at scale and volumes in different countries. It will reduce the time and money involved for developing the systems, especially for the developing and underdeveloped countries who struggle to develop the systems, and it takes a lot of time and money to do each system. It will enable the countries to mix and match different components, because each component is interoperable by design. We could just plug and play as we do with our keyboards and mouse when we connect to a laptop. And it will ensure that the systems are future-proof by design. So if I were to build a payment system now, any other system that integrates with it will be interoperable whenever it comes, because it is built as per defined specifications or standards, which is interoperable with other systems. So towards achieving these objectives, we started this dialogue series called Talking Interoperability. This is a monthly dialogue series wherein we are bringing one country every month, which are advanced in building integrated and interoperable social protection systems, to understand from them how did they go about building these systems from which they have leveraged so many benefits. What are the technical details? What were the aspects they considered for building this interoperability? What were the challenges and policy decisions they took to achieve this interoperability? We want to build with these webinars a community of practice which can contribute to the standards development under the Digital Convergence Initiative. And if the countries have some open questions, it gives us an opportunity through this platform of the Convergence Initiative to brainstorm on those challenges and contribute to solving the problems of that country. So to engage in the dialogue today on the host country, Turkey, we have a distinguished panel. We have three presenters, Mr. Erkan Dansov, Mr. Ali, and Mr. Ahmed, who will be joining during the Q&A sessions. We have two discussants, Mr. Rajiv Chawla and Thomas, and this session is being moderated by Madhumita Heba. So just to introduce Mr. Erkan to the audience. Next slide, please. So Mr. Erkan is a holds a degree in sociology and has worked on alleviation of poverty policies for 15 years, focusing on international social policies, research, and measurement of social development and strategic planning. He supported policy formulation for ISAS for over 2 decades, starting from 1999. He then subsequently moved to the Ministry of Planning and Social Services, where he was responsible for designing projects on social safety nets, the conditional cash transfer program funded by EU, and several adaptive social protection programs for the homeless people in situation of emergency and disaster. In between, he had a brief stint with FAO Turkey as a social protection specialist. Now I'll introduce you our next speaker, Mr. Ali. He is head of the social assistance applications in the ministry, in the General Director of Information Technology, Ministry of Family. He holds a degree in computer engineering and systems information management. He started his career as a software development way back in 2008, and now he heads the social assistance applications in the Turkish Ministry of Family and Social Services. He has been developing and creating many social assistance modules and sub-modules within ISAS. So we will be hearing all the technical details on this system from him very shortly. Let me introduce my first discussant now. Mr. Rajiv Chawla retired from civil service and was until recently the additional chief secretary with Government of Karnataka, India, where he led the Kutumba project, which is an integrated social protection system for the state of Karnataka. With a strong passion for technology-enabled governance, he has combined his administrative skills and technology prowess to bring about e-governance revolution in the country for the last 30 years. He initiated digitization of land record systems in Karnataka way back when digital technologies were not so prevalent in many governance systems. And he laid the foundations for the project called Bhumi, for which he was awarded the Prime Minister's Award for Excellence in Civil Service in 2007. Now introduce you to the next discussant, Mr. Thomas. Thomas is a social protection specialist with over 10 years experience in developing and deploying enterprise software applications. He is currently with the Social Protection and Jobs Practice of the World Bank, based out of Nigeria, and he works on improving the effectiveness of social protection delivery systems by leveraging innovative technology solutions such as big data and ICT tools. He is the co-lead for the Core MIS, an open source software solution that supports the implementation of social assistance programs in World Bank client countries. And finally, I introduce to you our moderator, Madhumita Heba. who is an independent consultant working on the design, implementation, and evaluation of social protection and poverty reduction programs. In recent years, she has also moved on to support digitization and digitalization of the social protection delivery systems across Asia and Africa, and in particular focus on developing robust registration and payment information systems. Madhumita is particularly passionate about the interplay between technology and inclusive service delivery, and she has been leading coordination work for OPM team, which has been supporting the Convergence initiative since the kickoff last September 2021. With this, I hand over to Madhumita Heba to lead the proceedings for the day. Thank you.
Thank you, Anita, and hello, everyone. We've seen Turkey's integrated social assistance information system presented at a very high level at various forums in recent years. I'm quite excited about today's session to zoom in on this big picture and really understand the inner workings of this integrated registry that draws on data from over 28 government databases, covers a whopping 55 million people or 65% of Turkey's population. Without further ado, I will hand over to Mr. Ejam to kick off today's presentation for the next 45 minutes. Again, as a reminder to the audience, please feel free to use the Q&A box to type your questions as the presentation progresses. Thank you. Over to you, Ejam.
Okay, thank you, Madhumita. Firstly, on behalf of my ministry, I would like to thank all distinguished participants today. We really thank to also the all partner of the USP 2030, and also especially organizer of the Digital Convergence Initiative, GIZ, ILO, World Bank, and UNDP. This initiative is providing all of us to share different experiences on interoperability and digitalization of the social protection system. And it's a big opportunity for us to present and discuss our system with you all distinguished participants. Let's start talk about our system, Integrated Social Assistance Information System. And you see our content of the presentation. Mainly our presentation is two parts. I will talk about the policy design of the social protection and especially social assistance system of Turkey. Then my colleague, Mr. Ali, will talk about the technical aspect and operational aspects of our system. In the Q&A session, our third colleague, Mr. Ahmed, he is the team leader of the ISAS. He will join us to answer your question. Yeah, let's see the Turkey general condition. Turkey, you know, is a middle-income country. Its population is very huge. It's 84 million. But GDP growth for the last year is the 11%, and GDP is about $800 billion. And GDP per capita is, you see, the $9.5 thousand. At PPP level is at $28,000, and Gini coefficient is 1.41. Yeah. Yes. You see this graph is the changes in the poverty level of Turkey in the last 20 years. Turkey has a great effort on poverty elevation. You see it was in all kind of poverty line. You see it was the 32.3 in 2022, now decreased to the 8.5. And you see there are sharp decreases in all kinds of poverty. last 2 years, as you know, because of the COVID-19 pandemic, there is a slight increase in the poverty level. Yes, Ali. In Turkish social protection system, there are five pillars: social insurance, social assistance, supplementary social insurance, social services program, and employment programs. There are five types of the programs. The main body of our social protection is the social insurance system. 86% of the total population are covered by the social insurance system, and 13% covered by the social assistance system. And I want to emphasize especially about the social assistance system. 20 years ago, our both coverage and the budget of the social assistance system is very small. It was just 0.3 in 20 years ago. Now 0.3 of the GDP. Now is this budget of the social assistance is about 1.4 of the GDP. And especially our system ISAS create a big opportunity to cover the people and also to deliver our social assistance system. Yes. What is our system? Integrated Social Assistance Information System is an e-government system that electronically facilitates all steps related to the management of the social assistance and established in 2010 through the integration of data coming from the 28 different public institutions, and we use the 120 web-based services in one easily accessible online portal. By this system, ISAS, Turkey has a standard and integrated and converted its previous to paper-based social assistance procedure into the electronic system. Yes, Ali. Yeah, you see our chronology of our social assistance program. The firstly, it started in the 1976 with the first our program till the 2010. We have created several social assistance program, but after the establishment of the ISAS, we could increase the type of the social assistance program. Now we have the 44 social assistance scheme in our system. And in this system, we have the 260 risk indicators in order to identify the beneficiaries. Let's go to the other slide. Yeah, you see the basic structure of the institutional structure of our system. Ministry of Family and Social Services is the main responsible body for the system, and there is a board under the ministry, the Social Assistance and Solidarity Fund Board. They are responsible of the policy design of the social assistance. Under that, General Director of Social Assistance, that's my directorate, is responsible to implement these social assistance schemes. And also the last one, the bottom line of the pyramid, is the local social assistance solidarity foundation. We have the 103 foundation in each district and country of the Turkey. So we have very very big human resource work in both ministry and the local level. It is about 2,000 people in the ministry and about 9,000 people in the districts. Yes, go. Yes. What is our basic characteristic of the ISAS? You know, social assistance is a social right. So that's why our all schemes are based on the right-based approach. And also we have created many administrative circular and codes to create our social assistance structure. And also you will see especially in the Ali's presentation, we have a very strong and functional software program. And before the ISAS, the staff in the foundation were not the skilled people. After the ISAS, they became very skilled person by training programs. And also before the ISAS, we had lots of impact analysis about our system, and that's why we had many lessons from our previous implementation. That's why our system builds on the lesson learned issues. Yes. Ali, I think now it's your.
Okay, it's my turn. Can you hear me?
Okay.
Okay, I'm going on with the technical aspects of the integrated social assistance system. Before going into details of the integrated social assistance systems, I want to show you a schema which shows the general structure of our country in terms of information sharing between organizations and the role of the e-government gateway mainly. And also the position of the citizen, as you can see from the slide at the bottom. We have an e-government gateway portal. It's named Turkey GoTR. So many of the government organizations and the municipalities are connected to the e-government gateway portal, and they serve many services over the gateway portal. Citizens may log into the portal and may apply for many services and query the situation of the citizen in terms of this related government organization. For example, if it has a tax debt or the payments he has got before, or social security situation. Many information can be accessed easily by the citizen from government organizations over a government portal. Additionally, our e-government portal takes a role of information sharing between government organizations, which facilitates providing complex services, which I mean that a service depends on another service. For example, if you are trying to provide a service to a citizen, then some data should be verified from other government organizations, and this government gateway also provides such a facility by providing government-to-government services. But I mean that a government, especially from our perspective, from our ministry's perspective, if we want to provide a service and share information with other government organizations, we provide this service to directly e-government gateway from the structure of network structure of Communet, which is a secure closed network within the government. And this service is then available by all other government organizations technically, but if we authorize or authenticate them. So it is technically very easy to share information from our perspective. For example, if Ministry of Health requires one of the citizens that he serves that if he benefited from the social aids, this ministry can easily connect with the e-government gateway, and moreover, many other government organizations, many of the government organizations are readily connected with the e-government gateway. So there is no problem of technical availability, preparing new services. If there is not an extra situation that's required an extra data or extra service, which is not readily provided by the ministry. I summarized the general structure of e-government gateway, and I will continue with the structure of the integrated social assistance system. Our system has been deployed started at the 2010. I mean that first module has been started to use at 2010, and for now it has reached to a 7 terabyte data size. And this is increasing day by day. Analysis of the system has been started 2 years ago, and it is implemented with one of the big government organizations, TÜBİTAK. It's also government organization, but mainly doing jobs about the technology. Our technology stack contains as legacy flex in our screens, flash technology, and we are replacing it with the React technology in the front end side. And in the back end, we use Java and Spring Boot in a hybrid model. And finally, in the database, we use Oracle database. Our social protection business processes supported our initial registration, grievance redressal, case management, eligibility check payment, and I will go in details of this in the next slides. There is in the structure of the integrated social assistance system, there is a web application part. This provides modules and for daily operations and supports daily operations. By using the web application of the integrated social assistance system, our end users from Social Assistance and Solidarity Foundations and Directorate General Social Assistance can access the screens and the data of the citizens and other government organizations. They do the daily operations, and also they take some reports from the system and support decision making. And additionally, auditing part is also implemented using the screens. Batch processes are a main part of our processes because there are many beneficiaries in our country, and only users cannot do all the job by themselves to evaluate all the data, collect all the data and make evaluation, and also create the payment list. Some of these operations are implemented with batch processes and some other group of servers. In this model, we, for example, make central investigation. In our terms, central investigation means that we are centrally querying some other organizations' data in terms of a citizen's situation. And payment pre-controls is a part of this process. We, for example, query the social security situation of the citizen from our social security institution as a part of the central investigation by using a batch process, and then decide that whether he or she is eligible for this aid. Preparing payment lists are also processed by this batch process servers, and it is initiated by the from the web application by the end users within the Directorate General Social Assistance. There are also some batch processes for updating the statistical data, and this is a model we have been using for about 10 years, but maybe in future, if there will be a business intelligence system, we may quit this model. Finally, we have a single database combining all the data, all the required data. And here you can see the visualized form of what I thought. Maybe I should place this slide before. You can see there are web application servers, which DGSA and the Social Solidarity Foundation users are connecting to the system. There are web proxy servers. Our web application server does not directly communicate with the other government organization systems. There is a proxy web server structure, and other organizations' data or services are accessed by directly or over e-government gateway portal G2G services, as I have mentioned before. There are also batch servers which are talking with the database server and also with the payment banks. For example, a batch server prepares the payment list and sends it to the payment banks or the post offices. Post office, I mean that PTT, you can see the yellow logo. It also simulates a bank in terms of payment process. We can see from here again the general structure. In a central database, a single database, it is connected via web servers and the web proxy servers. Housing data, taxing data, health data, education-related data, address data, and the assets that the citizen owns. All employment data, banking data partly, and cadastral data are all collected into one single database. Streamlined flow of information can be seen between agencies and programs to create and update beneficiary profiles. And additionally, this data is data is gathered from field visits, and all these information are also entered into the same database. Administrative data and the data collected from field visits are combined into a single data, and all this data is used for making a real and fair decision about the aid is supplied or not. This decision is additionally not taken by only just the data, depending on the data provided by the system. Final decision is taken by the Board of Trustees, which is a group of people which knows the field, which are assumed to somehow have an idea of the real situation of the citizens living in the vicinity of these members of the trustees. Mainly, these are the local people and local managers of this city or district, and we assume that if there is a misunderstanding or error about the administrative data we collect from other government organizations, they may know the real information about the citizens and real poverty. All of this collected data is used for data analytics, besides the payment process, for data analytics and beneficiary monitoring, and also auditing purposes. All those services are depend on the same data, and all those data is produced from the operational processes. You can here see a general screen of our system, and some information is blurred because of the personal protection of personal information law. But in general, our screen design is such that, but we are replacing this design and also infrastructure, client-side infrastructure, with a new technology and new design. Personally, I like this type of design rather than the new one, but it's a decision taken by us due to technological reasons, not only the design issues. Here I can explain what you see. Here is a summary of the house. These information shown in the screen contains both central investigations. What I mean that the information we gathered from other government organizations. For example, I can detect from this picture that there is a social security record of the citizen, and there are some aids he or she, this house is already benefiting, and some other regular and time-based aids. And we can also see from the right bottom left corner, I'm sorry, there is a house visit, and the what the social worker visited the house has recorded about this house. For example, he says that this house is a weak situation in terms of poverty, and they may be supported with extra aids. Here also we can see the general data and the process of the process of our system. Applications are made by the citizens with only a national identity number. Citizen does not have to declare much more documents, and only identity number is enough. But additionally, he or she also states that my information recorded in other government organizations can be queried by the Ministry or the Social Solidarity Foundations. There is no more document required for starting the aid application process. But as a new type of application, we have started yet to get e-government applications. We started to get applications from e-government portal. In this scenario, citizens enter into the e-government portal and only declares his situation and some other information about him, and states his situation. Then Social Solidarity Foundation workers may decide after that if he or she requires the aid. Whether the citizen applies directly to the Social Solidarity Foundation or he or she applies over e-government gateway, in all scenarios, we get the socio-economic data from institutions via web services, collect data. And if there is not an extra situation like pandemic, households are visited at their houses and data is recorded. All those information gathered from other government organizations and house visits are combined into a summarized data, and it is presented to Board of Trustees for deciding whether this family is eligible for social aids. After the decision of the Board of Trustees, Integrated Social Assistance System automatically prepares payment lists for eligible house lists. Type of the payments are sometimes regular and sometimes irregular. After the payment lists are prepared, these lists are automatically sent to the payment post office or the some other banks, which provides direct access to the money for citizens. In here, we can see the payment process, some more detail. Beneficiary and profile updates, compliance to conditions are implemented at the first step. And then after these, eligible citizens are added to the payment list, and these lists are after prepayment transmitted to the payment authorities like public banks and the post office, which is, I said before, working like a real bank. This money has been withdrawn by the citizens or beneficiaries from bank ATMs or the bank offices. Our post office also provides a cash card, and citizens may also withdraw their money from ATMs of the post offices. In every night after this step, payment reconciliation file is transferred to Integrated Social Assistance System. There is a strict control and strict view on the situation of the money we send to the citizens. After that, periodically, if there is a request, if there is a situation that we detect later, we send the payment to the bank or the post office, we may request for cancellation of the payment. If we see something, there is a new situation about the family that he or she does not eligible for this aid. Before the integrated social assistance system, our system was almost manually operated by the social solidarity. Our social protection system is almost manually operated by the social solidarity and assistance foundations. This has resulted in heavy workload on the SASF and the other public entities. All processes have been fully paper-based processes, and our social assistance programs are so fragmented. So these may resulted in low quality of information and lack of data which supports the policy making, and resulted in bureaucratic inefficiencies. This picture is a good and perfect summary of our former situation, former structure of the social solidarity, social assistance system. You can see the circles, many circles on a paper. This is the application document paper for the social assistance. Citizens take this paper or document as an empty document and goes through all other government public institutions and provides a seal. Every single circle on the paper is a seal that is an approval of that I do not have any social security record within the social security institution. Another one says that I don't have any car or vehicles. Another of the seals says that I declare that I document that I have no income, I have no cows or cows or sheep, animals, and citizens should have to go one by one all other government institution bureaus for an approval. This has resulted in the situation that bureaucratic inefficiency that I said before, and waste of paper, waste of many resources, and especially waste of time. And citizens should have to prove its poverty. But now, citizens only declare their identity number and give a permission that you can query my information from other government organizations. And finally, we have all the information for a real decision making. What is provided is one of the most important key points of this system I told before, is the national identity number. We have a long tradition in civil registration, and the first population census has been implemented in 1904, and Turkey started assigning unique IDs to every individual since 1990s. National address registration was launched in 2006, and unique address codes are assigned to each address. Each ID was tagged with a unique address code, and all public entities were linked to the managed and national address system. This is a key point to interoperability for us, because when we are querying a citizen that applied for an aid to our social assistance and solidarity foundations, using this national identity number, every single government organization keeps the citizen information based on this data. As we said, this was not singular before 20 years ago. Every single institution has given one citizen distinct or different numbers. Here we can see in some more detail what information is queried from other government organizations. From Ministry of Interior, we query civil registration, individual and family records, ID, name, gender, date of birth, marital status, and national addresses. Many other government organizations are also connected with the Ministry of Interior and place this data in his services. National identity number is also provided by the Ministry of Interior. Social Security institution is another our key partner. From that, we take the citizens' employment status, wage, salary information, short-term working allowance, and job loss compensation payments, and social security contribution. Public Employment Service also works for unemployment insurance and unemployment assistance. We are also querying from them that if a citizen is unemployed or taking the support or has an income from this institution due to loss of job. Turkish Revenue Administration mainly provides us the registration to tax system, but no more detail about how many tax is paid by the citizen. But we are taking a very valuable information about owning a motor vehicle in his country. This mainly shows a citizen have a car with a new model car, then we don't assume him as a rich people, but if he has not a car or a very old car, then he's assumed in a more common way as a poor people. Directorate of General of Foundations is another government organization that supports the citizens in some ways, and we are also querying if a citizen is benefiting from their aids. Ministry of Education is another our important partners in terms of conditional cash transfer and other some programs. Our citizens or children that are we are supporting should continue to the school, and so we are querying their attendance and enrollment data from Ministry of Education. And the school success is another information that we query from them. Institutional scholarship and dormitories also provides all the scholarship information that if one of the members of the family that is applying for the aid is a student in a university, and if he is benefiting a scholarship, it is also income. It is also assumed as an income of this house. So we query this information. Ministry of Health provides us a vaccinations, growth records, and disabled health records, and especially disability report. Because some of our aids depends on the existence of a disability report. In the past, we are gathering the paper form of the disability report, but since about 2 or 3 years, they are providing us a verified version, a digitally verified version of a disability report. This has facilitated our work about providing disability salary. Ministry of Defense also provides us information on soldiers and village guards. We use this information for a social assistance program that we support the families whose son or the wife has gone to the as a soldier, and he is not in his family with his family. So we support this family and ask if he is really soldier from the Ministry of Defense. From the Ministry of Environmental and Urban Planning, we query the land registry, cadastral information, and assets information. In fact, this is also a very valuable information for us that if a citizen has 3 or 4 houses or many land registry, we assume him or her as a rich people. But in this point, I want to state again that this information is not really convenient for an automatic accounting of the real salary or the real income of a citizen, because one citizen may have many land registries, but they are not a good location, so they do not provide any income, or if the citizen want to sell this land, it does not bring much money. So,
Mr. Sorry to interject. You have about 10 to 12 minutes to wrap up. Thank you.
Okay, I am going more faster. Ministry of Agriculture and Rural Affairs also provide information of plantation and extra support for farmers and extra payments. This is also a factor that affect the money. The post office and the bank offices are another parts of the integrations, and we mainly interact with them and interoperate with them in terms of payments. Data update can be triggered by the system users at any time, but usually it is done before each payment cycle of respective programs. In any case, a batch job works to update the whole database once in 45 days. Here we can see another screen of our integrated social assistance systems. In here we see the social security records, health insurance records, real estate records, vehicle records, agricultural land records, and income records. Additionally, social aids from other institutions and owned animals tax liability records. Every institution, we have some difficulties about every institution designs and keeps its own data and data structure. This is a difficulty for us. Currently, main purpose is to standardize the data within organizational data. Users that are entering data keeps track of the formerly entered data manually. And there's a project called as National Data Dictionary, currently aiming standardization of the data, and this work is conducted by the related Presidential Department of the Digital Transformation Office. Standards are assumingly managed or will be managed by the admins of the National Digital Department of Digital Office. Data standardization is a big problem for us, and as we said before, every institution designs the data in accordance with its own operational requirements. Interfaces are prepared in accordance with the requirements of the other institutions. What I mean that if one organization will share its data, it prepares the services in accordance with the requirements of the other institutions. As an exception, we have some big government organizations prepare standard services for all other government organizations. And we are also following a way such that we have implemented the social assistance information service and presented it over the e-government gateway. Other government organizations, if connect with our consume this service and get the idea if the citizen is a beneficiary of the social aids. Generally, interfaces or services are published directly by the institution, and there is no central authority for this. E-government gateway, as I told before, is only technical infrastructure, not a decision maker at this point. Almost all integrations are implemented by SOAP, REST services, and rarely FTP integrations are implemented when the data size is too big or the frequency is not enough frequent to connect with the web service. Country-level API gateway, e-government gateway is playing a role for a government-to-government services and use it as a proxy. And I gave detailed information about this before, and I will give more detail if questions are asked later. Commonet is a secure network infrastructure and is used commonly by almost all of the institutions. It's a network infrastructure, so there is nothing to say about the structure of the data and other details, only a network infrastructure for secure data sharing. For communicating updates to APIs, mail lists have been constituted by the owner and the sharer of the data. This is a big problem. In fact, some of the government organizations, without notifying the other government organizations that use his or its data, change the data or the data structure, and our systems depend on that data, may falsely respond to the query of the citizen. Official documents sometimes are sent to all stakeholders for notifying updates in advance of a sufficient time to adapt the changes. Some of our rooted and old big ministries follow a way to not to break the process of information sharing. Every single citizen should give explicit permission stating him or personal information by ink signature or using a new brand e-government service. Our law for the personal protection of personal information states this strictly. Organizational data cannot be accessed without strict prerequisites between government organizations and official writings that explicitly defines which data will be shared. Identification and authentication processes are handled by the e-government access control protocols as a technical gateway. But as I said before, the real permission is given by the owner of the data. Data is accessed via integrated social assistance system with an authorization mechanism. Data is preferably shared between government institutions over Commonet directly or e-government gateway. Information sharing decisions are taken by a data sharing council within DGSA. At this point, Mr. Ercan will continue, I think.
I think I want to talk about the fifth point about the factors for providing success of ISAS. Especially, it's a very comprehensive and complicated system, and that's why we need an interdisciplinary perspective. Lots of our different types of different type of the people have worked in this design of this system, information, IT persons, statisticians, social policy expert, and also among our team, there was and there is still a democratic understanding, and also in the design of the system, there is a horizontal organization at the ministry. It creates a fast decision making and implementation. And also governments gave the big support to us at financial and administrative level. Yes, please. Ali. And as I said before, we have trained all people in the system, both in the ministry and at the local, and we are still giving the training to our staff. We transform the human resource capacity, And as Mr. Ali said that adoption of the national identity number was the crucial point to establish this system. As you see, all these factors is enabled poverty mapping. What we get from this system, we can get the poverty mapping, data reporting, supporting software, monitoring and inspection, and also future poverty grading. And our system, as Ali said, that is up to date, is based on the up to date information on beneficiaries. Yes, Ali, go on, please. Ali, you are mute now.
So, I'm sorry, I'm starting again. There are some challenges, of course, about when we are talking about the interoperability, technical problems. We have some big data synchronization problem. In fact, when we want to verify all of the beneficiaries of our applicants of the aids, there is we need a time to more time or more resource from other government organizations to provide the data for our requirements. Some of the very big and infrastructurally good government organizations provides the services for only the changing data, and this facilitates us. But some of them does not provide such an information. So you have to query all of the beneficiaries of an aid or some other aids for almost 5-6 million people. This takes too much time and provides some problems. Lack of extensity in technology literacy of the related person is sometimes was in fact a bit more big problem, but by the time is going forward, this is a less problem. Data and data format modification sometimes we encounter, especially from some specific government organizations. How this affects us is that situation we are putting some controls from the data we are querying from our counterpart organization. If the code of some data is changed without notifying us, then the beneficiaries may be their aids may be cancelled due to this data misunderstanding. This may be result in the cut of the aids of about 10,000 people at one time, and this is a big problem to really compensate. Data dictionary problem is a minimal problem. We understand the data of the counterpart organization, but in general, we are also having such a problem. Interpretation of the understanding of the data is also a problem, because not only the codes we are talking about the data. For example, the status of the citizen is 1 or 2 in an encoded form, but not this is not the real problem. Sometimes this problem goes into the domain. What is the meaning of 1? We know the meaning. 1 is he is working or he is not working, but details may not be as simple as that. Evaluating, I maybe want to state the organizational problems somehow. Evaluating the real values from presented data is an issue for us. Determining the exact cost of the real estate, house or landing is not always possible for us. So the Board of the Trustees have an important role at this point, and also the workers of the Social Solidarity Foundations are playing an important role that if a land, which is a very big land, but maybe it's a very far destination from the city, so it does not cost money, it does not provide any wealth to the owner of the owner of the citizen. But there is a very little land in the center of the city, and if the citizen sell this land, little land, he may be a rich people. We cannot see from our data perspective this issue. So localization is an important factor for overcoming such problems. Determining exact cost of the vehicles has also some similar problems, but not as severe as the determining the cost of the house or landing. Computing the net salary from gross salary is also a problem for especially the citizens working for a company. The salary, determining the salary of the government workers is an easier task, but especially the private sector workers, salary of the gross salary, we cannot easily determine the net salary. In the future, interfaces to be added or modified. This is a continuous process in accordance with the requirements. So there is nothing to do about the changes. We should somehow adapt these changes. New data standards to be introduced, and REST is being more common rather than VSDL. New technical standards are introduced by the services, and we are also trying to integrate with these new standards. It takes too much time to integrate with a new service of a new government organization, urging to more strict rules for security, but somehow these difficulties can be overcome.
Mr. Ali, can I please request you to move on to the slide on COVID-19 support? Perhaps we come back to this later. The final slide. Then we can move on to the discussion.
One slide?
Yeah, if
yes.
we can do the last slide now, the one on COVID-19 adaptations.
Okay.
Thank you. Then we can come back to it during discussion again on the lessons learned.
Yeah. Yeah, I think we can talk about the lessons learned in the Q&A session. So I just want to emphasize that having such a system, we can easily reach the people in the COVID-19 pandemic. And about, I think, 2.5 million households were reached at that time by using our system. I don't want to give the details of our schemes in the COVID-19 as you see in the slide, but this system provided us to reach and to deliver the social assistance, especially not just the poor, people at the poverty risk. We can reach, we have reached especially people at the poverty risk. And also, as you know that we have running, we are run the one of the main social assistance system for the refugees is called the ISAS for Syrian refugees. Also, we can run this program, the refugee assistance program, by using the ISAS. If there are some question about the COVID adaptation or the ESSN or the lesson learned, I think we can talk about in the Q&A session. Yes, Madhumita. Thank you.
Thank you, Mr. Ajjan and Mr. Ali. That was a very interesting presentation, especially for those of us who are working on low and lower middle income countries, which built the first generation of social registries using primary data and now moving towards integrating existing databases. It's really interesting to see how you've used existing databases and combined it with other complementary methods such as household surveys. I have a lot of questions on the data standardization challenges that you mentioned, which is the core interest of the DCI. But in the interest of time, I will first ask Uwe Thomas from the World Bank to come in with his questions and reflections. Over to you, Uwe.
Thank you, Madamita. First, let me thank Ejan and Ali for a very detailed and clear presentation. I'd like to commend the team for building a robust delivery mechanism, delivery platform that is used by external administrative units to the core SP unit. And it's continually evolving, as highlighted in the presentation. Like Madamita said, there's a whole lot of questions to understand, but we are limited by time, so I'll try to keep my thoughts and questions sort of at a much high level and hopefully simple and straightforward. So I'll just go straight into some of the questions I had after listening to the presentation and the presenters as well. And I think one thing I would like to touch on is something similar to what Madamita just raised in terms of the data and the interoperability as a whole, where the web services come in between each and every one of the stakeholders and players. And it's a bit of probably a twofold question. It's probably if you could spend some time to help us to understand how the governance structure evolved, to sort of build the data exchange framework you currently had. What are the key, are there any pushbacks from the agencies? And what was that key advice that you give people who are trying to set up governance and structures, in terms of, what made Turkey's own successful? Was it based on the fact that there was, an e-governance vision of the broader government as a whole, or was there personal interest from the various stakeholders? Then on the web services themselves, are they directly only managed by the ISAS team, or are the other stakeholders? So you mentioned the whole myriad of agencies that work with IJA or that with ISAS, or that exchange data with ISAS. So do they have their own web services, or do they just consume the web services that is exposed by ISAS? So just probably let's start there and see where the time takes us. Back to you, Jan and Ali.
Arjan, do you want to take the first question on the governance structures and any pushback from different agencies on sharing of the data?
Yeah, Ali.
Okay. Governance structure of the data exchange framework, in fact, does not really structurally exist such a data exchange framework. In fact, all data exchange processes mainly initiated by who is really required the data, and he or she, it is still for our ministry, it is still current situation is such that if we consider, or business part of the social protection consider that if there is a requirement for such a data that is beneficial for our social protection processes or evaluation processes for poverty, or provide some operational support for us. For example, integration with the payment stakeholders for banks or post office is an operational process which facilitates our citizens access to the money. Another example of such information is such that citizens come to our social solidarity foundations and make an income test for deciding whether they some payment for their social security or health insurance health insurance payments, periodic payments. we decide the situation of the or income level of the citizen, and then we send this data to the Social Security institution for registration. In this situation, we communicate with the Social Security institution one by one and one-to-one, because this is a job between us and them. So there is not a central governance structure in terms of the business perspective. But in the technical perspective, there are e-government gateway, as I tried to mention before. Did I understand the question truly, or is there any clarification required for that?
No. So it's clear. So in terms of operationalizing, there's no central governance structure, but on the technical side, I think the e-governance gateway sort of helps that interoperability happen at the technological stack level. I guess that would be. I don't know, Adrian, any additions to that, or should I, put in?
No.
Second question.
I think.
Sorry.
Sorry, go on.
Was the second question about implemented web services implemented and managed solely by the Integrated Social Assistance team, or do other government agencies have their own external facing web service? There was such a question. We currently manage our web services in a way that if the current services are meeting the requirements of the requestee at the counterpart government organization, we firstly offer them to consume our existing services. But if there is an extra requirement and there is an extra development requirement for a new service, then if our business part of the social protection process request us to develop a new service that is required for other government organization, then we take this request into our development cycle, and as soon as possible we define a new service and serve it from e-government gateway if there is not an extra situation or condition.
Okay, I think that's clear. You keep it at least centrally managed at the ISAS level. So I know we are sort of pressed for time, but I'll just sneak in one more question there, Madam Ita, if you don't
just one
mind.
more. Yeah,
and just sticking to sort of like this whole idea of governance, I'd like to sort of pivot to issues around the data. And during the presentation, you mentioned that currently you have about 7 terabytes of data, which is quite a lot. So it would be sort of good to understand what your current, how you manage that increasing data, your current management structure and your policies. Do you have a data retention policy that you're currently working with? What's that data management policy like? I don't know who's going to take this, but over to you guys.
In fact, managing the big data is a problem, especially as you see that there is a big data over there, which is being kept from almost 1 decade, more over than 1 decade. In fact, 12 years, and you can use this information for policy making, and you should manage them. I'm not even telling about the performance issues for managing big data. We are constantly taking some precautions for our system to work stably. But in terms of the policy making and the reporting requirements, we may plan to implement a business intelligence project to provide our managers to good reports for supporting policy making and designing new social assistance programs, detecting the gap, if there is a section of our citizens recorded in the social assistance program, but not supported by a specific condition. For example, it was a good good example should be that we supported the women whose husbands has died, and we make a decision for supporting them from our previous data. Is that okay, or if I miss a key point?
So just probably one key point that I would like, just for the benefit of the audience as well, is in terms of the data retention. So does it come a point in time where you probably archive data and move it away from the main database, or discard the data? But is there any such policy currently enforced, or is that being planned for the future?
Of course, we are working on a data warehouse project and want to move some old data. I can say that old data from operation, separate the data from operational system to move data warehouse. But this is a very difficult task. We understood that because our business part of the business owners of the Directorate General Assistance, Directorate General Assistance, they say that we require all the data all the time. There is such approach, but we are trying to how we can meet this requirement by both using a data warehouse and taking some data to data warehouse and keeping operational data simple, but whenever they need such a data, and they will access this data from data warehouse. This is also a big problem for us. You noted a good point. In fact, it's our problem, which is working.
Okay, I think I'll stop there and hand over back to Madhumita. I think this is definitely an ongoing conversation that we'll probably reach out bilaterally with Ejan and Ali, and hopefully we can continue. But thank you guys so much. This is really great to have listened to you guys. Back to you, Madhumita.
Thanks, Uba. I think the last discussion on data retention also answers an audience question around how long do you hold on to the data regarding people, especially if they've become ineligible over time. So we can mark that one as answered. With that, I will now invite Mr. Rajiv Chawla to share his reflections and questions. Over to you, sir.
Thanks, Madhumita. I had some small 2-3 questions. One is, you are deciding the eligibility of a citizen based on the data you have. So 2 questions here. Can citizen see his own data? And if yes, can he object to that data? Can he have grievance redressal?
Mr. Ercan, would you like to come in?
Yeah, thank you, Mr. Chawla. And we have a scoring formula to check the eligibility of the people. And as I said before, our system is the one way. Beneficiaries have very, very limited access to the system. They can see their applications in the e-government portal, but they can't see their all information in the system. So if they want to change something, they can apply to our local units to change their form.
Right. So it would be a good idea if you can put some mechanism in place to let them see their data so that they don't get excluded from the system on the basis of some erroneous data. This is a suggestion you may consider. The second question I have is that you have a central database. I mean, you have some 20-25 administrative databases. What happens in case of a conflict when our data is submitted by a citizen or through a field visit? If you find that there is a contradiction between these 2 data, how do you resolve? Take an example. The field visit says that he has 10 units of land, whereas the cadastral says he has 5 units of land. In general, whenever there is a contradiction between the databases and the field visit, or the information which citizen gives, how do you resolve such contradiction?
Can I answer to this question?
Yes, Ali, please.
From one perspective. In fact, we are querying the data from other government organizations, and they are providing same data to their local offices using some other systems. Sometimes we encounter with such a problem that even a contradiction with the field visit and the system, their data that is presented to us from web service contradict with the data they are presenting to their local offices. In such cases, Social Solidarity and the System Foundations firstly accept true as the document that is provided by the local bureau of the information provider organization. If there is a document with a signed version that is contradict with our central investigation data, web service data, then it is manually disabled by the Social Solidarity Foundation user. Then it is not regarded. This is a way. As the second part of the question, of course, the house visits are more important in this point, because there is a contradiction between the data presented by one government organization and what the social workers see in the field. In these cases, maybe the social worker may request from citizens that his document his situation from the contradictive data owner of the contradictive data organization. From technical perspective, we are having problems, as I said, from the data source.
I think it would be a good idea if you have more reliability on the data sources. After all, they are the authoritative data provider. And if your local units do inspection, they should not generally do inspection in respect of those data points which are coming from the authoritative databases. Otherwise, you have a very serious contradiction between these systems. Of course, sometimes it can happen that the primary data sources itself cannot be believed. In such case, you may perhaps not use that at all. But creating contradictions can really harm citizens by way of they proving which data is correct and which data is wrong. I have a third question. I saw in one of your slides that there are 5 programs, social assistance program, different varieties. One is given by your ministry and the other is given by the Labor and Social Ministry, Social Security Ministry. Now, do you share data with them or not? You should at least share the data which is, of course, the 25 departments, ministries, whatever data they have. But the data you get, because they are also providing services of similar type, do you share data with a Labor and Social Security Ministry or not? Social Services Ministry.
Ali, as Ali said before, we can see and we can access to the other governmental bodies databases, but they can't directly access to our databases. For example, especially there are 2 big unit in the Ministry of Labor, the Social Insurance Department and the Employment Agency. we are working closely, I can say. For example, if they demand something from our system, our databases, we can share with you, but with them, sorry, but they can't they can't access directly to our system. Maybe
any reason
I
for
don't
that?
know in the future.
Is that a technical problem or is that a policy problem?
I think policy problem, because in our bureaucratic structure, all the governmental bodies are established as vertical position. For example, in our system ISAS, there is a horizontal administrative structure, but in the Turkish government administrative structure, every ministry or the general directorate has own authority. They don't want they don't want other governmental bodies interfere in their authorities. That's why still our databases of our ministries are still separated. But in the e-government portal, every ministries have the different part in the e-portal, but they can't. These databases they cannot see each other. Maybe in the future, our system is not the Belgium cases as we discussed in the last month. Still,
Okay.
our databases are separated. Okay, thank you.
Okay, the last question, a small one. Can you avoid field visits? What is the data you are collecting through the field visit, which is, I mean, is that data you are collecting which is not there in the other department, other ministries' databases, or what else you are collecting through the field visit?
Yeah, I think maybe I wanted to add something when Ali answered you about the house of visit. House of visit is not just the only inspection. It when you visited that household, you can have a chance to see the different kinds of vulnerability in that places, or you can find another household live in the poor conditions. So household visit is not just for the inspection. So and also yes, we checked their declaration about their situation. Moreover, when we make the household visit, we may see that household, that family needs some social services. After that, we have some referral services for the household. In our social services department, we say that our colleagues, we visited that houses. We can provide some social assistance to them, but they need also do some social services. For example, there is a member having a chronic illness or disabled or another things. So how field visit create this visit provide us to see or to intervene the different kind of the vulnerabilities at the policy and implementation level. Thank you.
Okay, thank you, Madhumita. I am over.
Thank you, Mr. Chawla. And in fact, Ejan and Ali, we also have questions in the chat box about what is the type of data you collect during home visits that are not available in the existing databases. So perhaps after this session, it would be a good idea to get more information on this and publish it as a part of the learning brief so that people have a better overview of what's coming through existing systems versus what needs to be collected through home visits and what the justification around that is. Thanks again, Mr. Chawla, always stimulating great philosophical discussions around this topic. With that, we'll move quickly to the Q&A. The first question from a colleague from WFP is whether this system, the ISAS, is available to international development organizations through APIs or application programming interfaces. Would that be Mr. Ali or you, Arjan, taking this?
As I know, there is no information sharing with the international partners. In fact, there is a data sharing council within the Directorate General Social Assistance. If they prefer to share some data, some aggregated data or personal data with international partners or with other governments, it's technically possible, but it's a decision which has to be taken by the administratives.
But maybe I want to add something about this one. Yes, many international organizations, WFP, UNHCR, or the other UNICEF, have been working with us for many years. They can use some data, but not directly. You know, we have the Red Crescent, the Kızılay. Kızılay will be an interface to use this data, but not the personal data, anonymous data. Is it okay?
Got it. Thank you. And then I'll move on to the next question, which multiple people have raised, which is an indication of the setup costs of ISAS. What was the startup investment in building the system, and what do your operational costs look like? Is there any data that's readily available you can share around the costs of running the system?
Not a direct cost could be shared with as an answer, but of course, information system development is a costly process, and during the first development phase and the first operational few years, there is a software development team consisting of 25 person developers and at least 5 support personnel for training or for supporting operational processes, answering the or detecting the problems sent by the Social Solidarity Foundation users. So maybe it can be predicted from the number of the software developers, and also there has been a infrastructure investment about servers, network servers, and the database server. So I can briefly say that it was not a cheap process, because we just don't provide the social solidarity foundations for the system for only the social assistance process, but also enterprise resource management properties are also provided by us to the social solidarity foundations. For example, when they will employ a new personnel, they will do all their job from this from our integrated social assistance system. That's why we call the system integrated. Many other properties are provided the system.
Got it. This also resonates with the discussion last month that we had on the estimating the costs of information systems and how it can get quite complicated because of the different types of costs that are involved. Thanks, Ali. The next question we have is, if you have any data or insights on the impact of the ISAS, any estimates of savings made because of reducing duplication, any estimates of number of hours saved for citizens and going through the application process, anything you can share on that? Thank you.
Yeah, maybe we have many advantages by using this system, especially as you remember in Ali's presentation, there was a document have lots of the science of that pages took, I think, 15 days for 15 days to complete for the applicants. And also the decision-making process was maybe more than 1 month. But now we can check we can get all the data about the applicants in a few seconds, and then the local board can decide in a few days for the participants, and we can give the last of the examples about the how we we get the efficient way to use this system, and time consuming and the bureaucratic procedures. But there are lots of, we can share maybe in the final version of this PPT.
Yes, that would be fantastic. I really like that picture with a lot of fields. I think a picture says more than 1,000 words. So it's quite interesting to see how the legacy system has transitioned. Our next question is around the number of indicators that you use to calculate the poverty score. How many variables or data fields are there that go into the estimation of the poverty score that are stored in the ISAS?
Ali, you want to say something? Or I think in my presentation I have said about the we have the 260 risk factors or indicators to calculate the scoring formula or vulnerability of the applicants. So it was, I think it was about 50 indicators at the beginning. Now we have developed our scoring formula. We have the 260 indicators, but this scoring formula does not mean only this applicant is poor or not poor at income level. We also measure the vulnerabilities, as I said before. For example, as Chawla asked us about the house visit, we can get some information about the household or the family's vulnerabilities by visiting their homes, households. So it's a very big, maybe very complex formulation, calculation about the scoring formula. We can maybe talk about in the next webinar.
Sure. A follow-up on that, of the 260 indicators that you do have, are all of the 260 collected through existing databases, or are they collected through your Solidarity Foundation's officers?
Yeah, both.
It's okay.
Solidarity officers, databases, and also house visits.
Okay, so the three of the sources together
yeah.
make up 260 indicators. Okay. Yeah, let's continue this offline because 260 is quite a big number. It would be good to understand details around what comes from where as we try and understand the system better. Another question we have is around the data updates. How often do you update the poverty score? I think I know the answer to this question, but I want to ask this for the benefit of the audiences.
I may answer this question.
Yes.
For some regular aids, we periodically, before the payment list is prepared, we periodically and systematically, with a batch process, we query the information about the citizen or the households, especially in terms of conditions. For example, conditional cash transfer, conditional cash transfer strictly depend on the social security situation of the citizens. So before the payment list is prepared, we query the basic information about the person, about the citizen, that if the citizen is still alive or citizen is registered to the social security institution, we query this information. And besides that, as we stated in the presentation, end users can also refresh the situation of the citizen from the central investigation manually at any time, whenever he wants. Other data, household visits are also an important part of the decision making, and this depends on the situation and or the conditions of the Social Solidarity Foundation. Some of the Social Solidarity Foundations are in the relatively little districts, and in this situation, household visits can be more often can be implemented, but in especially big cities, it is a bit difficult to implement these household visits.
Thanks, Ali. I mean, as someone who's worked a bit on data update models for social assistance information systems, I've always been impressed by the amount of human resources that are deployed in Turkey to update them, but it's also good to know some of the challenges that the geography poses around such a model. The next question we have is around data sources. You did show us a lot of ministries from which the ISAS draws data. Do you also draw any data from private companies? During COVID, we saw a lot of countries using data from private companies, right? For example, mobile phone records was one that was used quite frequently. Are there any examples from your side of using data from private companies, or is that something that's not done?
I will answer these questions. Up to this time, we have not experienced such a situation that we query any information from a private company. But about 2 or 3 months ago, we have initiated a new program, new social aid program, natural gas aid, and we have a condition that the applicants of the social aid should have a subscription to a natural gas provider company, and subscription number is a prerequisite for us. And we could not integrate with all our government with all private sector companies that are providing natural gas. And there was about over 70 organizations. At this point, e-government gateway has a good news for us, and they have provided us the validation of this subscription information from our from all of the private sector companies. Otherwise, we would not be able to communicate and integrate with all those companies. At the stage of the application, when a citizen has registered to login and try to apply our social aid about natural gas, e-government gateway has checked his address and the city that he is living and match this information. The private companies that are serving this city, and this reduces the number of the web services that they will call from 70 to about 1 or 2 or at most 3. This has facilitated their query process, and they have validated truly if the citizen has a real subscription with a private sector company. This is a really exceptional situation for us, and has been implemented successfully within the last 3 months.
Interesting. That's an innovative workaround around accessing data held by private companies. I will try to understand a bit more around how it was implemented offline. I guess I will now ask the final question before I hand over for closing remarks. I'm sure there is lots unanswered, so we have to keep this conversation going offline and try and learn more about the system. One of the things, Mr. Ali, you mentioned is because there is no common data dictionary or a data model, interpretation of values becomes challenging. Are there, I know you said there is a national data dictionary that's currently under development. How are you involved in that process to make sure that your the variables that are important for you are defined in a way that is useful for delivering social assistance? And the second question is, without the data dictionary, how are you currently managing to ensure that you are interpreting values correctly and you do know of any changes to the definitions of data collected by other ministries?
This was really the hard part of our integration processes. In fact, I don't expect very high benefits from the National Data Dictionary, but this process really requires strict communication between the two parts of the data interchange. And another success factor is the trial and error, and detecting the exceptional cases and handling them meticulously, because sometimes you take an error from the data sent from the government organization, partner government organization. You name it as a specific issue, but it may affect more than one person, one citizen. So it's not an easy process to conduct such a situation, especially when the domain of the counterpart organization is specific and you can't interfere some information from their domain. For example, when you query ownership of a car, this is not a problematic data information sharing, and the meaning of the data is quite simple. You look at the model of the car and the age of the car, and you mainly say that this car is value of this car is about 10,000. But especially the most difficulty about these integrations and the evaluation of the data of the social security information, because they have deeply historical data. They have about 50% of the extra people of the country, because that people are also recorded in their system. So they are a very rooted and old system. and renewing constantly, and their business rules are also constantly changing. Their data are dependently changing. So services are changing, or new codes are added, and we haven't been notified before the change is reflected to the leave system, because their job is very difficult, because they are working with the all citizens of the country, and everybody is registered to their system, and everybody somehow is related with the social security system. We can also understand their problems, but we have always having some difficulties with the interpretation of the social security data. For example, for about 1 week, we are trying to understand the identify truly to the last start of job. As I openly say, when these citizens started at the last time for a new job, detecting this date from the data provided by the Social Security institution is quite difficult for us, because there are many scenarios. Not only the data structure, but also the data itself is sometimes problematic, or there are some exceptions. This is a problem, but we are trying to solve the problems one by one, and as soon as we encounter with them, and try to strictly communicate with the counterpart organization. Okay.
Thank you. That's a very interesting example, especially because countries are trying to target social assistance to those who don't have social security through formal sector employment. So understanding who can be targeted out is quite important, but the number of definitional issues to consider while building data standards can be quite crucial. And I'm hoping when we discuss this further offline to prepare the post-session dissemination materials, we can dig into this example a bit further and understand how exposed you're trying to standardize definitions and actually use this data. This has been a very enlightening 2 hours. I have more questions now than I started off the session with, which I guess is a good thing, because we've all been exposed to the inner workings of the system. So thanks again, Mr. Ercan and Mr. Ali, for taking the time to join us today. With that, I hand over to Veronica Wotzak from ILO for closing remarks.
Yes, thanks a lot, Madhumita. And I can only join you in congratulating all our resource persons of this session for a really lively and exciting session, and the wealth of information provided by Mr. Ali and Ercan on the system in Turkey, which is really impressive to see. Or also how fast, in a way, this has been set up. I mean, if this only started in 2010, to see how far you've come, this is really amazing. And I won't even try to summarize that rich discussion, but just to thank also Uba and Rajiv for the interaction and taking the discussant's role, as well as, of course, to Madhumita for the excellent moderation of the session, and Ahmed, who was in the background as a backup to provide additional information. Thanks a lot to all of you. And just as a teaser, there will be another one of another session of this series on in-depth dives into country experiences with building interoperable social protection system information management systems. The next one will be on Chile, and we will send out the invitation for this session that will take place in June shortly. So watch out for the next edition of this series. And thanks a lot to all of you for joining and listening to this. Bye, everyone.
Bye. Thank you.
Thank you. Bye.